Self-esteem is defined as a person's own appraisal of his or her own positive or negative value based on their own self-judgment. In essence, self-esteem is a measure of one's self-worth, which contains more of an emotional connection to it. Positive self-esteem can lead to many good outcomes such as better mental health and actively promotes healthy functions and positive social behavior. On the other hand, negative self-esteem has an equal amount of impact on an individual's mental health as well as physical health. Negative self-esteem can lead to a plummet in self-appreciation and can possibly create a negative view of oneself, which can indirectly lead to an individual's manifestation of other mental disorders such as depression and social anxiety. Health Direct, along with the CDC, guidelines state that some signs of low self-esteem can include, but are not limited to, being too critical about yourself in a negative connotation, focusing on your negatives, as well as ignoring your achievements, always blaming yourself when things go wrong, having fear of failing, not accepting of compliments from others, and feeling sad, depressed, anxious, ashamed, angry, or worthless at times. They also state that symptoms of low self-esteem have a wide connection with signs, and they can include, but are not limited to, depression and depressive moods, low self-efficacy, which is an individual's belief in his or her own capacity to execute behaviors necessary to produce specific performance attainments, which has an indirect connection to having fear of failing, having difficulty with social relationships, and some have problems with their own body image. A couple other ones include usage and abuse of drugs and alcohol, and lastly, some struggle with an eating disorder. Common causes of low self-esteem can include discrepancies between an individual and themselves. For instance, in their prospective study among young adolescents, Garber and Flynn found that negative self-worth develops as an outcome of low maternal acceptance, a maternal history of depression, and exposure to negative interpersonal contexts, such as negative parenting practices, an early history of child maltreatment, or negative feedback from significant others on one's own competence, as well as family discord and disruption. The impact that self-esteem has on children and adults in the US is very drastic. Roughly 80 to 85% of individuals in the US suffer from low self-esteem to an extent. In 2022, Sigler reports that more than 1 in 3 high school students have had persistent feelings of sadness or hopelessness, and it has increased since 40% since 2009. Gutman in 2019 states that by age 17, 78% of girls are unhappy with their bodies, and more than 90% admit to feeling pressure to look a certain way or would change something about how they would look if they could. In the case of young adults, a study was conducted with 12,686 young men and women in 1979, 1994, and biannually since. Results concluded that about 14% of this study showed that mainly men who were affected by low self-esteem showed a correlation with having depression, and about 16% of those same men showed a correlation of mediating these feelings with substance abuse. Sani states in her article in 2016 that exercise has a direct physical improvement on self-esteem because perceptions of body image, physical competence, and health become more positive simply due to the feeling of the body improving through exercise. Some direct ways exercise has on self-esteem is having a healthier cardiovascular system through physical activity and being more muscular. Some indirect ways that exercise can improve self-esteem is increased physical activity as well as perceived physical fitness. Individuals who see themselves getting better would want to see a more positive perception of themselves by striving to continue to keep this view and to continue exercise. Other indirect factors can include having higher self-efficacy. So, I chose this topic because I used to struggle with low self-esteem and self-efficacy. A lot of this pertains to the fact that I had the inability to participate in a lot of activities during my adolescence because of my own perceived image. This topic is still very relevant and important to me because I find myself having low self-esteem during times of hardships, whether I'm finding myself lost or having feelings of inadequacy. After seeing more information on it, I can definitely see how causes were really personal to me, which is why I chose this topic. I struggled with finding a good image of myself at a young age because it was particularly hard for me, at least for my family, to support me emotionally when my parents were busy all the time. And it was particularly hard to experience a healthy self-esteem, mainly because of the negative parenting practices, such as negative reinforcement. Now I want to support others in their journey to finding themselves and being able to create their own healthy image of themselves, because self-esteem can definitely be something that can either help you prosper or destroy you. You are your own worst critic.